A new joint report by the Texas Tribune and ProPublica examines the death of a Cuban immigrant inside the Camp East Montana Detention Center in El Paso. The report is raising questions about mental health care, detention conditions, and oversight at that facility. Perla Chorizo is the reporter behind this investigation. She's joining us to talk more about it. Thank you so much, Perla, for being here with us.
Thank you for having me.
So your report centers around the death of this Cuban immigrant. Tell us about him.
So Geraldo Lunas Campos was detained in New York and taken to the Camp East Montana. So that's the facility on military land, Fort Bliss in El Paso, Texas, in West Texas. And he arrived in September, I think September 6th, and he died on January 3rd.
And what did the medical examiner's report reveal about his death?
Yes, the coroner in El Paso ruled his death a homicide. There had been some use of force, and he died by asphyxiation. Initially, Immigration Customs Enforcement, or ICE, had said, he had been found in medical distress. Later on, as reports were coming out of what the ME, the medical examiner El Paso, was about to rule, they said that the guards had to use a force to prevent him from killing himself.
Yeah, I think this is the case that we heard a little bit about. There was also some concern in your report, you pointed out, about the care he received while he was in detention. Tell us about that.
Yeah, as you mentioned, I think, a lot has been written about the day that Geraldo died, precisely because it was, I believe, for the first time that a death in custody had been ruled a homicide in ICE custody. What we obtained or reviewed was an extended medical examiner investigative report. And in it, it chronicles what happened to him before he died, which we did not know much about. So we knew that the day he died, he had been calling for his medication, had been complaining that he had not gotten it. Witnesses had talked about how he had become distressed, and this had been a previous issue. But the documents we reviewed show that on multiple times he was asking for his medication, he was complaining about the dosage, he was saying that he was not getting, he was growing frustrated. And even a medical provider in one of the cases noted that it had been 4 days since he had obtained his medication and they were not in the medical card. So it showed a pattern throughout his time at Camp East Montana, where someone who was known that he had mental health illnesses, and yet he was not receiving the medication that he needed to help with his depression, with anxiety, to allow him to better sleep at night.
Someone would perhaps assume then if it happened to one, it's happening to other people there.
And yes, we're definitely had heard, and across the country, mental health concerns have always, this is not necessarily something that is new under the Trump administration. There have been issues, long-term issues, but experts and what we hear from detainees themselves or former detainees is that they have become exacerbated as you have more people coming into detention, people perhaps from the interior of the country who might have more illnesses or the stresses of how they were detained, for example, during a worksite raid or the operations in Minneapolis. It's leading to a lot of more mental health issues, and a lot of these facilities are not as equipped to handle the cases, either because they don't have the staff to do it, they might not have the resources. If you're dealing with a facility that's overcrowded, they might not have the time to really assess every individual and provide the level of care that they need, which according to the medical experts we asked to review the nearly 300-page file, they say that there's a clear pattern. One of them call it systemic neglect, that shows that this was the multiple crises that led to the moment that resulted in his death.
And when you ask the federal government about this, about their, their own report, this extensive report, what do they tell you?
Unfortunately, we did send Department of Homeland Security, ICE, the White House, all of our findings and very specific questions to what both our findings and what our medical experts were telling us. They did not respond to that. More broadly, ICE has said that for a lot of these immigrants, this is the best healthcare they've gotten in their lives. With Geraldo, they issued a death report that they are required to submit, in which it says that he was provided the assessments, they were monitoring him, that he had a range of medications that he was taking, and again that his death had come was a result of a use of force incident that where he was trying to kill himself. So, even though they have not specifically commented on our questions, more broadly, the administration stands by the quality of the care that immigrants receive inside their detention centers.
Something we know you will continue to be watching, as well as all of us here. Puro Terviso with the
Absolutely.
Texas Tribune and ProPublica. We thank you so much for your time.
Thank you for having me.